What is the best treatment for scoliosis? Scoliosis is the development of an unnatural sideways curvature with rotation, which would make scoliosis a three-dimensional condition. Scoliosis is progressive, meaning it's in its nature to worsen over time, which is why proactive treatment is so important. Scoliosis progresses, meaning the size of the curvature increases, and as it increases, the condition's effect becomes more and more serious or more evident. And this is typically a result of developing uneven forces throughout the body and the effects that that leads to. Scoliosis can range widely in severity, from mild to moderate to severe to very severe. And again, it's expected for curves to worsen. And we know curves typically worsen mostly during growth, meaning the adolescent pubescent growth stage. And this is what triggers rapid progression. However, once scoliosis moves into the adult form, it still progresses, but it just progresses slower as a result of gravity over time. The more scoliosis progresses, the more complicated it is to treat, meaning that as curves worsen, we can never get the same results as that if we treated it when it was more mild. So what makes progression of scoliosis harder to treat? Why is a bigger curve harder to treat than a smaller curve? Well, as scoliosis curves get larger, the bottom line is the curve becomes more rigid. It becomes stiffer. And the stiffer a scoliosis becomes, the less responsive it is to any type of treatment. This is conservative or surgical. This increased spinal rigidity is what makes it difficult for certain patients to perform certain types of therapeutic activities. It could also create stiffness and pain. So therefore, it's this increased spinal rigidity is one of the hurdles that we have to overcome when we're trying to reduce the size of somebody's scoliosis. Also, the effect also increases with it as long as the progression. So as curves become more severe, they causes increasing effects like pain and discomfort, which could make treating the curve more difficult. So treating a curve more proactively can prevent any of these effects to occur. So therefore, we can easily treat the patient because they're more functional and have less pain. So there are different ways to treat scoliosis, and the two main approaches are something that I call traditional approaches versus conservative approaches. Now, even though traditional approaches has their own conservative branch, but the conservative treatment under the traditional branch is very, very limited. And it's very important that patients understand that the types of treatment that exist out there, because if you normally choose a traditional type of doctor, you're going to typically get led down those traditional potential outcomes, where if you treat a conservative doctor, you're going to have these potential outcomes that can occur. And traditional treatment really addresses scoliosis in a reactive way. They normally wait for curves to worsen, and as they worsen, they increase the invasiveness of the treatment. So it typically involves watching and waiting when conditions are mild, when scoliosis is mild. They normally don't recommend any treatment and just watch and see what happens. And if the curve worsens, then they would start treating it. But however, our argument is that mild curvatures are easier to treat. They're going to get better responses. And if you treat a mild curve, you'll never get a moderate or severe curves. And this is one of the main shortfalls of traditional treatment options, is the curve has to worsen to a moderate stage before they even consider a treatment option. Once the curve hits a moderate stage, the only treatment they recommend is going to be one group of patients. And these are going to be adolescents that are rapidly growing. They would use a Boston brace to try to slow down the progression. Outside of that group, no treatment is recommended. They again just watch and wait. And then if the curve were now progressed into severe classification, then the only treatment is recommended is spinal fusion to try to reduce the curve. So you can see mild curves not treated, moderate curves are not treated except one group. And then everybody else, once they get to the severe category, it's pretty much spinal fusion. So this type of treatment tends to funnel people towards spinal fusion because not much is done to try to stop surgery from becoming an option. Where in conservative treatment approaches, the goal is not to let a curve progress to become surgical levels. Surgery is a last resort, not the only resort to reduce a scoliosis. It's the last resort after everything else doesn't work. Conservative treatments are non-surgical, and typically I like to say is they're chiropractic centered. And the reason why they're chiropractic centered is because chiropractic approaches tend to try to treat the cause of the problem before it becomes severe, as opposed to letting a curve become severe and then considering surgery. Conservative treatment is proactive because we want to treat the scoliosis as soon as we diagnose it. We want to treat it when it's small, and as soon as it's part of its diagnosis, because the smaller the curve relative to that curve, the easier it is to treat. And therefore, by treating it in its mildest, smallest form, we're going to have the best opportunity to reduce curves and prevent the effects of scoliosis. Now, traditional conservative treatment approaches normally integrate many scoliosis-specific treatment options associated with it. It's not limited to one thing. It's not limited to just chiropractic care, not limited to just therapy or corrective bracing or just home therapy and rehabilitation. It normally combines all these things on a structural level. And that's the key thing, is that this conservative treatment must treat the structure. Many physical therapists, many chiropractors, many exercise physiologists treat patients with scoliosis, but they could be treating the symptoms of the scoliosis. The goal isn't structural curve reduction. The type of conservative treatment I'm talking about here is structural treatment to reduce the size of curve to achieve corrective results on the scoliosis, which means reducing the curve. And this is done, like I mentioned, using a series of different types of therapies in chiropractic care to actually get this to actually happen. So we use structural chiropractic care to help realign the spine into a straighter position. Now, most physical therapy is normally just done to increase core strength or spinal strength. We're looking at structural physical therapy that's used to help reduce the size of the scoliosis. It's very different than just trying to make your body stronger or trying to make your body more flexible or more range of motion. We're trying to reduce the size of curve. In addition to just trying to use a brace to try to slow down the scoliosis, like traditional bracing, conservative corrective bracing augments all the therapy and rehab and chiropractic care that we're doing to help push the spine into a straighter position. And last thing is that we use specific home scoliosis exercise that we call scoliosis rehabilitation, and we combine those to help stabilize the spine in the right alignment. So this combination of therapy is what produces a very corrective result for scoliosis. And the last thing I like to mention here is the way the treatment is administered. Most therapy in the traditional mindset is done long and slow. They do a little bit of care over a very long time, and that tends to work good when somebody's injured, and that's what you do for injury rehabilitation. Most scoliosis patients are funneled into this injury style of treatment, low dose, long duration. However, scoliosis tends to respond into something that we call intensive care, where it's a high dose, short duration treatment. So not only is everything I mentioned structurally based, which is not the practice of most therapists or chiropractors, but it's also inverted in its dose to actually get the curve to reduce. So the best scoliosis treatment is one that acknowledges all the limitations of traditional therapy and rehabilitation and exercises and changes the approach into a very customized structural scoliosis approach. Here at Scoliosis Reduction Center, we have patients that benefit from this type of treatment, and because it prioritizes the scoliosis as the number one thing that we need to deal with at a structural level. And normally we like to do it proactively to prevent progression before the curve worsens and never have the patient experience the need or the decision that they may need spinal surgery or invasive spinal fusion, which can definitely alter the patient's future life and outcome. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.